Getting a COVID vaccine is more complicated right now, given the timing of when the FDA released its indications and approved uses, and due to the fact that we hadn't quite had an ACIP or CDC endorsement at the moment. The way that in pharmacies and pharmacists, their scope of practice works, it's dictated by their state, and many of the states at the time had the authority tied directly to the ACIP or the CDC approval. Since we hadn't had that yet and vaccine had already been getting shipped out and patients already asking for it, it has created some strain and some confusion out there, but we anticipate that with the modifications of the state scopes, that pharmacists should have no issue being able to protect their patients for this upcoming COVID-19 vaccine season.
Simple as what? I mean, I think they should let them know.
There's been a lot of confusion as to what we can and can't do, and a lot of unclear guidance, which we're hoping in the next few weeks will eventually be cleared up.
How about you?
It's usually much more of a fluid process where the FDA approval is kind of synonymous with the ACIP approval, and once we get the product, we can usually administer it right away. This year, there's a little bit of a delay and a lot less clear guidance as far as what we can and can't do.
But I have had trouble getting the vaccine, and I don't necessarily understand why someone over the age of 65 who wants it can't get it. Not getting a shot, it's starting to affect me going out into public spaces.
Flu shot?
Yes.
Getting here for a COVID shot?
Yes.
Medication for seizures.
Your annual flu shot, your COVID-19 vaccine, your adult RSV vaccine, if you haven't gotten that in your lifetime. Right around September, October is starting to be the best time to get those because your body has enough time to form antibodies and protect you before we start getting into that high contagious transmission season, which we see November, December, January.
19 disease in the past 4 weeks? No. All right. Do you have any questions?
In a majority of states, we see that patients who are meeting the FDA indications are eligible to get a vaccine at the pharmacy from their local pharmacist. And in the other states, we at the American Pharmacists Association are working very closely with the state associations, with partner organizations, physicians, to put into place either standing orders or executive orders to assure that patients can still get their COVID-19 vaccine from their pharmacist.
Here they had this footage of no mask. So it never...
Diabetes or heart disease? No.
Our goal, pharmacists are healthcare providers, so we don't want to get into the political spectrum. We want this to be, scientific-based evidence as far as what's best for the patients.